I'm Maritsa Georgiou in Washington. This is Scripps News happening now in America. We just heard from President Donald Trump and HHS Secretary RFK Jr. talking about this new announcement about a potential link between taking acetaminophen while pregnant and autism. So we are going to continue monitoring this news conference with the president and health officials, and we will bring you any updates. Of course, our own White House correspondent Haley Bull is there, so she will also update us on the other side of this. But right now, we want to talk to Dr. Greg Marchand, board-certified OBGYN, who joins us kind of to unpack a lot of what we just heard. So, Dr. Marchand, thank you so much for being with us. I know you listened in to the president's comments and Secretary Kennedy's comments, so let's just start with your reaction about what you just heard.
Well, I'm overwhelmingly kind of pleased about what I've heard so far from this. Went out and said that it was probably a good idea to go ahead and stop Tylenol because Tylenol usage in pregnancy may be connected to autism. So actually didn't go as far as to stop it, but to use the minimum dosage and to try to spread out those dosages. While we already knew that there was some data on connecting Tylenol and autism, we didn't have any strong data yet. So it seems like he's implying that the NIH has some much more rigorous studies they're going to be releasing soon. So I'm very excited to see that data. And I'm also excited to see the data about the vaccinations. His ideas were kind of common sense in that he just wanted to separate the vaccines that are given to children, separating them out, make it much easier to tell if there's one particular vaccine causing a particular side effect or some other connection between vaccines interacting with each other. So overwhelmingly, I'm pleased after what I've heard. There were really no very big, red flags as to anything has to stop immediately. But he was pointing in the direction that there's likely research that's going to be released showing a connection, a more intense connection between Tylenol and autism, and that vaccines probably should be separated out in childhood.
So can you expand on that a little bit more? Because what I heard the president say was, he said, I'm not so careful with what I say. Taking Tylenol is not good. I'll say it. It's not good. I didn't hear him say that there's research that they're looking into. I heard him say that kind of full stop. It's not good. So when he says something like that as the president of the United States, I mean, what do you think the reaction from the public will be?
Well, he did say that at first, but then he did backtrack and he said, something to the extent of there isn't really another replacement for Tylenol in the third trimester, which is correct. There really isn't. And there is no other drug for high fevers. If you get a high fever, the fever could certainly do more damage than the potential connection between Tylenol and autism. So I don't think it was a hard stop that Tylenol is gone. He certainly could try to ban Tylenol in the U.S. if he wanted to. I believe he was just sharing that the NIH has some exciting findings. And before those exciting findings are released, he wants to preliminarily tell us that we may want to consider informing pregnant women that this could be a drug that has some risks. Previously we thought because of the limited data, the most we had was 4 observational trials and a meta-analysis that showed a very small possible connection. But it seems like now that the NIH is focused on this, we're likely to see a stronger connection when this data is finally released.
So what kind of conditions would you prescribe one of your pregnant patients acetaminophen? What kind of things would you prescribe that for right now?
Well, before I was aware that there's going to be more data coming out from the National Institute of Health, I would use it for basically all aches and pains of pregnancy. As you know, round ligament pain, pain in the lower pelvis during pregnancy, it's sometimes referred to as lightning crotch. Acetaminophen works very well for that. Lower back pain is extremely common in pregnancy, especially in the lumbar spine. And these are things that Tylenol works very well on. So now for these conditions, if it's going to be before 28 weeks, ibuprofen will be a very good alternative. But after 28 weeks, we're really going to be at a loss for what to use. And we'd have to consider in some situations, perhaps using stronger pain medications. That would come with some risks of having some babies be addicted, neonatal abstinence syndrome, but maybe a better choice than Tylenol if this data does show a strong connection between Tylenol and autism. Also, Tylenol is used for fevers during pregnancy. Again, we could use other non-steroidal anti-inflammatory medications prior to 28 weeks, but after 28 weeks, we really don't have anything. So as the president alluded to, we may have to continue to use Tylenol for high fevers because that could actually be more dangerous to the pregnancy.
Yeah, that's what I wanted to ask you, because he said there's no downside in not taking it. Nothing bad can happen. But are there conditions where, I mean, what conditions are there that something bad could happen in pregnancy? Because we know some women are more susceptible when they're pregnant to adverse reactions.
Yeah, I think he was mostly referring to the fact that there's going to be less of a chance of autism. Right. Taking that a little out of context, you certainly could say that he is kind of being a little bit insulting to women that might suffer in pain. You know, the third trimester is, of course, the most painful point of pregnancy. And now we've essentially taken away the main element that they use. The main source of relief is usually acetaminophen. You can do a little bit with, massage, warm baths, heating packs, but acetaminophen is the majority of the care for that third trimester. And we'll be in a tough situation with a mother with a high fever. Now, I haven't seen the NIH data. I'm hoping that it's robust and convincing, but it may be a situation where we still use Tylenol for high fevers after all the data is released, or it may be that we have to use something else. Ibuprofen, naproxen, aspirin, they all run the risk of the closure of the ductus arteriosus prematurely on the fetus, so we generally stay away from those after 28 weeks, so it will certainly be a risk versus benefit situation.
All right, we want to thank you, Dr. Marchand, for joining us here on Scripps News in reaction to this press conference, and we will be right back.